How can C4D research lead to changes in government programs and policies? C4D Specialist Massimiliano Sani in Mozambique uses the example of a research study on vaccination. It revealed communication barriers between nurses and caregivers and eventually led to changes in the government training curriculum for nurses.
We have used formative research especially for the to design a C4D plan for immunization. Already, we did the research in 2012 and 2013, and then we informed basically the national plan for C4D for vaccination. I mean, to boost especially the routine vaccination. And actually, we discovered something very interesting, that apart from the problems that we were expecting in terms of knowledge, attitudes, and behaviors at caregivers level, actually there was a huge gap in terms of interpersonal communication between nurses and caregivers and mothers especially. So we developed a new program in terms of interpersonal communication. We use focus group discussion with the nurses, community health workers, and caregivers, and then do some triangulation of the information that were coming out from in the same districts and around the same health units. So even if sometimes, you know, especially the nurses tend to put the problems on the side of the caregivers, on the caregiver side, actually it was exactly the opposite. And the activists and the community health workers tend to provide more neutral and more probably sincere answers when they are asked where are the problems of communication between the systems, between the system and mothers and caregivers. So I think that's important to triangulate information. Another issue was that basically simply mothers were saying that there is a big gap in terms of language spoken. Sometimes nurses are not necessarily working in those. I mean, they are not natural of even those provinces that they are working in. So sometimes they are moved from one province to another, so they don't speak the local language, and that's a big barrier. And actually, when we present this problem to the district level managers, actually they just realize now that they never thought about it. They never thought about that the allocation of the nurses should also respect a criteria of the language spoken, or at least they should try to accommodate or take the best use of those nurses that really speak the local language in more in those, for example, health units where they know that the local population do not speak Portuguese, for example. So that was something quite simple, quite obvious, but that actually the health system was not using as a criteria for the distribution of nurses. And then also we basically discovered that, of course, the overload that nurses are suffering in terms of work sometimes also hampers their capacity and their ability to really do a proper interpersonal communication session. So they were always relying on the morning talks. At the beginning, very early in the morning, usually you have all the women waiting for vaccination, for example. They do the talk, but then all the mothers that arrive late, for example, they will miss the talk and they won't be, let's say, counseled on what to do and when come back. I mean, they are probably told when to come back, but they are not really counseled on which vaccines are needed for what, the difference between the connection between one vaccine and specific illness, differences, etc., etc. And then, of course, there is also a cultural barrier that caregivers suffer, that they don't feel at ease to ask questions. That's a big problem. Usually talks are very unilateral, and they feel afraid that if they ask for clarification, basically they are considered let's say ignorant, or how is it possible that you still don't know these basic things on vaccination that you already came back 2-3 times, you should already they are even, sometimes there is even a problem of I mean, the behavior of nurses sometimes is very rude and not polite. I think definitely this is this kind of issue should be really identified by C4D through research usually, or through consultation. or through using civic engagement program like You Report, for example. So you can use also innovative tools to basically collect the frustration of specific segments of the society to bring back and advocate to the government for changes in how the programs are being implemented. For example, I think the training on interpersonal communication skills should be mandatory in all the nurses training curriculum, which usually there is already a component, but is very weak and is never really implemented. So this can, our advocacy to ensure that this component is really taken as a serious component, I think it's important. Also, for example, the health section is supporting the training of the community health workers. And so far, also the training on how to use interpersonal communication skills to better communicate with caregivers and with communities was not also on the spot in the trainings. Now, from this research, it came it came really important. And now, in the revision of the curriculum, they increased the time that is being given usually for this topic. So I think definitely C4D needs to collect the evidence and do advocacy in the programs, both at UNICEF level, but also at ministry, in the line ministries, to really push for change.